Meantime, Governor DeSantis was in Tampa today attending USF's World Cancer Research Day symposium. He and the First Lady announced $60 million in funding for continued cancer research. State health officials also addressed the recent controversy surrounding the Trump administration's claim that there's a link between Tylenol or acetaminophen in pregnant women with autism. Well, the state's rollback in COVID vaccine recommendations also came up. So busy. Let's go to Fox 13's Kylie Jones watching this closely for us with all the details. Kylie.
Yeah, Mark, a lot of healthcare discussions going on today by some of the state's top leaders. As far as that new funding goes, that funding will be dedicated to cancer research and specifically nutrition and how it can be related to cancer prevention. Applications for grant funding will open up to Florida-based research institutes, universities, and healthcare facilities. Florida is taking another step forward in the fight against a battle that has touched families around the state.
We're at war with cancer. We should all be in it together.
Governor Ron DeSantis and First Lady Casey DeSantis announced $60 million in funding for the Florida Cancer Innovation Fund.
This cycle's applications will focus on research related to preventative nutrition as well as emerging medical treatment options for cancer patients.
The First Lady has championed cancer research, treatment, and prevention since her own battle with cancer. She shares one of the main goals with this new funding.
One is nutrition and health, to really try to prioritize and incentivize grants and funding for prevention.
The Innovation Fund joins the Cancer Connect Collaborative. For a 5-year term, the collaborative will focus on pediatric cancer, opening grant opportunities for the state's 4 children's specialty hospitals, including Johns Hopkins.
They're going to be able to expand clinical trials, improve treatment protocols, and advance real-world cures.
The discussion around health care continued Wednesday. Florida Surgeon General Dr. Joseph Ladapo and the governor were asked about recent efforts to roll back long-standing vaccine requirements for children in school and stop the use of mRNA COVID vaccines.
Like I've heard people, how are anyone going to be able to survive if there's no mandates? You do it by just basically taking care of your family as you see fit and at physicians.
At the federal level, earlier this week, the Trump administration released a controversial report about a link between autism and the use of Tylenol or acetaminophen during pregnancy.
Not all the studies find that, but some of the studies do find that, and some of those studies are very good. So I think that their recommendation is the right place to be in terms of discouraging its use.
Ladapo also acknowledged the data and studies are, quote, messy. And the Surgeon General said he is still looking into the developments and the data, but when asked about his guidance, he said it would likely be in line with FDA guidance, which is that pregnant women should talk to their doctor and make that decision with their doctor. He did also point to FDA guidance allowing some use of acetaminophen because fevers are also dangerous for pregnant women.
Sure. We know that happens quite often, too. Kylie Jones live for us. Kylie, thanks much.